This is Kathryn Getzky, host of the Hope Matrix podcast. We are here to share science, stories, and strategies for how to hope. I'm the Chief Hope Officer of the Shine Hope Company, and Shine is the mnemonic for how we teach hope. So when we talk about hope, we talk about how we use stress skills, happiness habits, inspired actions, nourishing networks, and eliminating challenges, which are our thinking patterns that get in the way of our ability to hope. Hope is a skill. You can measure hope, you can teach hope, and you can start practicing skills to activate higher hope in your life today. And on this Hope Matrix podcast, we aim to bring in guests, experts in science, people with stories, and those that have strategies for activating hope in your life.
Thank you so much for joining today, the Hope Matrix. Super excited about our guest today, Neli Rowland. She is here from the Safe Haven, and we are here to talk about homelessness. Welcome today. Thank you so much for joining, Neli.
Hi, Kathryn. Great to be here with you. It's been such a long time. I'm excited to be reconnecting with you.
I know. Yeah, it has been so long. So we knew each other back in the Chicago days. And yeah, so it's great to chat here. I'm excited to have you because, homelessness is something that so many people feel hopeless about, right? And hopelessness is both a feeling of despair and it's a sense of helplessness. So we feel bad about this issue and we don't feel like we can do anything. And so I'm having you join to just kind of have a conversation today about what can we do as citizens and what are you doing at a Safe Haven to kind of address homelessness and take us from feeling despair about it to feeling positive and like we can do something, and then from feeling helpless to taking action about it. So that's kind of one of the things. And the other thing is to any tips or advice and just the work that you've had in terms of what people that are homeless can do about their situation. So we'll kind of look at that from both lenses, if that's okay. And again, really grateful. Homelessness is growing, and so it's great to have you here.
Well, Kathryn, oh my God, that's a lot that you've asked me.
I know, and we have 30 minutes.
I am so glad you're asking, because this is a crucial conversation that we all need to be having right now. We all know that the pandemic has impacted people that are now being blindsided. And, while they were living okay, paycheck to paycheck, and that was about 40% of the population pre-COVID, believe it or not, the pandemic has caused them to have a reckoning moment. As states around the country are extending moratoriums, to give them some relief and buy them some time, the truth is many people have lost jobs. Many people have lost jobs permanently. And there's experts that are predicting that there's going to be about a 40% increase in the number of homeless in America. And it was already an epidemic prior to COVID. And today, it's clearly become something that's, turned into something else. And, my worst case fear is that it will be a pandemic, right? The aftermath of the COVID-19 pandemic will lead to a pandemic with the opiate epidemic and with also the homeless epidemic. And that is a description that's used when it affects people across all economic strata, across all walks of life, across all communities without any discrimination, right? So that is the fear. And what we know and what we've learned over the last 26 years of being on the front lines of helping the homeless is that so much of it is preventable, right? And that's the good news. And back in 1994 was when we started a Safe Haven. And Nelson Mandela said something which was extremely profound. He said, poverty and homelessness are not natural. They're man-made and they can be overcome by the actions of human beings. So it was our own actions, when you think about that, or inactions, that caused us to arrive at this moment where we're recognizing homelessness as a major issue. And the good news is we can reverse engineer it just as easily if we are intentional and if we are willing to do our part. So gratefully at A Safe Haven, because we've been at the tip of the spear of this issue since 1994, we identified early on the fact that the way the systems were set up were really by design, unfortunately hurting a lot of people that were caught in the lowest rung of the economic strata. God forbid you were poor and you had a substance abuse issue, for example, right? And you got arrested and you couldn't make bail. And now, by the laws that were in place, you have become a career criminal, because the idea of going to jail and getting arrested and going to prison and coming out has not solved the underlying issue, nor was it a moral issue. It was a disease, right? And we've known that substance abuse, for example, has been a disease since the 50s, believe it or not. That's what the World Health Organization said. That's what the American Medical Association said. But what we noticed is, while we knew that it was a disease, our systems were actually treating it as a moral failing, and therefore it became a criminal justice issue. So today we're woke, right? They say. And now we know that we made a lot of mistakes, but what are we going to do about it? Today, we have choices. And I'm really proud to know and say that A Safe Haven has created a very integrated, comprehensive model that takes people in and starts to assess each individual. We're not a homogenous community, right? We all come from different backgrounds, have different problems and reasons for ending up in homelessness. Some people come to us because they have insurmountable medical expenses and had to file for bankruptcy. Some people had substance abuse issues. Some people had domestic violence issues. Some people coming out of prison, kids aging out of the juvenile justice system, veterans coming home. I mean, the list goes on. And A Safe Haven really understands that while people come to us, have different issues happening, we must have a multifaceted and multidimensional response. And thankfully, we have a whole team of professionals that represent people that are feeding them healthy food, right? So we have a culinary arts program that not only trains people to work in the field, but also understands nutrition and is feeding people healthy food. We provide semi-private accommodations. We provide them a safe place to live, whether it's by themselves, with a roommate, or with a mother with children. We also have a place to get them behavioral health care services with a full team of psychologists and case managers, and connect them to job training, jobs, and permanent housing. So we do this for about 5,000 people a year. Not everybody makes it. We're not for everybody. We do hold people accountable. But the good news is about 70% and the vast majority of people do make it out to the other side with the ability to support themselves and their families. And those that don't make it the first time, they get a chance to come back, and give it another shot. And most times, the second time around, it works, because now they know what they're coming into. Now they know what's expected of them. And I encourage anyone that wants to learn more to go to our website, asafehaven.org. And we're expanding right now. Kathryn, we've actually are opening up and building a veteran project in Hobart, Indiana. And we hope that as more cities and more mayors around the country are looking for ways to address and solve and heal the root causes of homelessness, that, they call us. And hopefully we've got a lot of lessons learned. We can help them get to solutions sooner rather than later, especially as our resources are so precious and so few.
Yeah, absolutely. And I think that's one of the biggest challenge and why we feel such despair about it, because there are so many different problems that people with homelessness face and are experiencing, whether it's health issues, whether, it's challenges with work, and mental health challenges, a big part of that. And it sounds like you've really systematically kind of addressed that. And one of the things that I just loved about you when I met you and what you're doing is you take a real business approach to it as well. So it's like you build in ways to kind of sustain, to help create a sustainable organization, and then to have them sustain themselves in society. So you kind of look at where they're lacking and what can help meet those needs. And it's such an innovative way to, I think, address homelessness, instead of just giving housing to people and not addressing the underlying kind of causes of why they're homeless in the first place.
Yeah, you're absolutely right. And I credit a lot of our training. My husband and I actually, well, first of all, we both grew up in families where we experienced near poverty and substance abuse. As first generation Americans, both of our parents came to America, one from Ireland, one from Mexico, with basically the shirts on their back. So they learned the hard way how to claw themselves out of poverty and be able to eventually raise families of 7 and 5, respectively. So how they did it, I have no idea. But they did it, and for us, we felt that, we were extremely fortunate And we're blessed to have both be the first in our families to go to college, and get degrees in finance and marketing, and to have very successful careers in finance, and investment banking, and as a woman and someone in the field, that really didn't have a whole lot of connections at the time. I was able to make a career out of it for 13 years. So it was really our ability to look at systems and look at what worked financially and what was sustainable and what wasn't that allowed us to be successful in our careers of finance, right? So we took that same mindset and applied it to what was happening with our systems in terms of dealing with poverty issues. And we found that many of the well-intended systems that were built to protect us, right, and to help those that were in crisis actually had the unintentional consequences of perpetuating the problem, making it worse. So when we talked about building prisons starting in the 90s, and every state was given incentives to build more prisons, the unintentional consequences was we were creating mass incarceration, right, from people that could have actually gotten help in a treatment program instead. So we looked at that as being financially unsustainable and very catastrophic to individuals and families for generations to come. So for us, we followed the money and we couldn't find a return on investment. So even if we took these people and put them in the criminal justice system so they can pay their dues, when they came out, they were never going to become positive, productive members of society where they can get a job and pay taxes and support their families. And now they become our responsibility and our burden for the rest of their lives. And their children are. How does that work for anybody? It wasn't. So we knew we had to think about what could we do to bring our pragmatic financial skills into a field where we couldn't find anyone that was really thinking about this issue holistically, systematically, and looking for measuring performance metrics that included the ability to connect people to jobs and permanent housing. What we found was most of those systems, whether it was a hunger organization that was feeding people or whether it was a criminal justice system, was what we did is we measured the number of people that we fed or the number of people that we incarcerated, but we never measured what was the end result in terms of those generous or draconian systems. So we knew that we had to really inject what was pragmatic, right, into the equation. And thankfully, my husband and I, took our own resources really to prove the model. And we invited some investors for the first 5 years. We weren't taking anything for granted that we had a theory that worked. We just said, well, let's try to prove the pilot. And after 5 years, we had a tremendous amount of anecdotal evidence that our model and our system was working. And by having that in hand, we were able to go to the public funding streams and say, hey, look, as you're releasing people out of the criminal justice system, we notice most of the people that come to us have a criminal justice background. Why don't we just cut that lead time and get them straight into our system as they're being released from prison? It's called a reentry program. We started doing that since 1999. Today, there's a lot of talk about doing that more. And again, we have a model that has stood the test of time and has got a lot of practical experience and a lot of anecdotal stories, and experience to show that our system works.
Congratulations. Yeah. I mean, and with a 70% success rate, and when you look at getting from that feeling of despair on dealing with homelessness and then a 70% success rate, I mean, that can get people and humans out of that despair. I know so many programs for homelessness have failed because they aren't taking a comprehensive approach to the solution. They're just housing people and they aren't addressing the underlying issues in the first place. So kudos to you for accomplishing that.
Thank you.
Really amazing. Yeah. So getting from helplessness to inspired action for people, how can they do something? How can they engage with you or start something in their community to deal with this really challenging issue?
Well, that's a great question because right now happens to be the time of year where 80% of the donations that we make to philanthropy are made, right? Mm-hmm. And as I described earlier, many of the well-intended organizations out there that have been well supported looked at the issue from a siloed approach, right? Whether it was hunger, whether it was giving people a place to sleep at night. But put yourself in the shoes of someone who has tremendous potential. You're hungry. Yeah. You also need a roof over your head, but you also want to get your life back on track. And unless that system is integrated and seamless for you, it's going to be very, very hard to make that happen. So as we're thinking about giving this year, I want them to really take a look at what are the organizations that they're giving to, and at the end of the day, are they really, really designed to help heal and solve the root causes in a way that's putting people on a path to their highest level of independence so they can pursue their God-given potential? Or are we giving to systems and models that have only one facet of the problem being met? So ultimately, I believe that there's a direct correlation with our values, where we give our money, even where we spend. So we have social business enterprises. So we know we have had people that nobody in a million years would want to hire, because they have backgrounds and they don't have, references, and pretty much have burnt every bridge when they were in crisis, if they even had a job. So we have social enterprises. So we have a landscaping company, for example, that's very famous in Chicago. We do the beautiful medians on the Cultural Mile and Magnificent Mile that tourists from around the world admire. And the people that do that work are actually people that are in our programs. And last season, we were able to employ over 123 people. And people that, again, nobody would have ever hired. And for everyone that hires our landscaping company is indirectly pulling through our employees back into the workforce. So that's another way. So you can either give to an organization that is meeting and addressing and healing the root causes and getting people on a sustainable path where we are breaking the cycle of poverty and homelessness. And we've got a 26-year track record to prove that we've done it generationally, so as the kids grow up, they're now living the dream themselves. Or you can hire a social enterprise as you're looking at who are you spending your money with, in terms of any type of service that you want to think about a social enterprise, as a priority. And also, A Safe Haven does affordable housing. We're always looking for investors and partners to partner with us, to say, in our market, do we have a need for affordable housing? Why not partner with someone that has a model that is designed not only give them affordable housing, but how do you keep them living in affordable housing in a sustainable way? So our model comes with wraparound services so that anyone that lives in an apartment that may have had challenges in the past has a direct connection to people that will understand what to do if for whatever reason they lose a job or they relapse or they're dealing with an issue that requires more assistance. And thankfully, we have a model that does it all.
That's amazing. And so is that what you're doing? You're taking your model and putting it in other cities? You're able to do that?
Yes. Well, right now we're super excited to have partnered with HUD and the VA. In fact, HUD named A Safe Haven as a demonstration project in 2018. So we are also by the Department of Labor been given a recognition, what's called a vet hire organization, which means that a very big percentage of our employees are military veterans, right? So we also are really proud that among our staff, about 38% of our employees actually are people that have had a background of some kind or have been homeless at some point in their life. So we believe that in our entire DNA of our organization really walks the talk, and we've been doing this since day one. But yeah, so we are now expanding into Hobart, Indiana. And we're very grateful to have a mayor there, Brian Snedecor, who has been extremely welcoming to our model, and also a governor in Indiana, Eric Holcomb, who is personally familiar with A Safe Haven, as he took the time prior to him becoming governor to come and visit A Safe Haven and see our work firsthand. So we encourage any mayor and any governor that's looking again for smart solutions to give us a call, come take a tour. And hopefully, if you like what you see, we can help you do it in your market too.
That was amazing. And we talked a little bit offline about what's happening during this pandemic, and specifically for you and the homeless community during the pandemic, and how you're keeping people safe there. I'd love to hear a little bit, about how the pandemic has affected you and kind of strategies you're using for that.
Yeah, it's been unbelievable. For the last 26 years, we have always tried to appeal to the hearts of people to give and to be engaged with helping the homeless. And, obviously, we all know that from every religion in the world, that it's so important for us to prioritize helping those that are in need and in crisis. And that's always been an appeal that we feel that has resonated with a lot of people. We've also appealed to people from a financial position, right? And said, look, do you know that by helping a homeless person and investing $1, that we actually saved our markets and our communities $7 on the back end, right? So there was a study that was done in the state of California by the University of Chicago back in 1994. And this was one of the catalysts for A Safe Haven, even starting A Safe Haven, where they said that for every dollar the state of California spent on treatment, the state actually saved $7 because they had less cost in police protection, emergency health care, foster care, incarceration. I mean, the list goes on, right? So for me, that was a wonderful piece of information that I thought the whole world was reading. I said, wow. So, for me, I just followed that playbook and said, the more services we give people, the more successful they are, the more money we save as taxpayers, right? So we appeal to that logic, right? And many studies have come out since then that have showed that the numbers are even higher. There was a Columbia University study that came out that said that the number was closer to 12-1, right? So any way you look at it, even if it's a 2-1, it's a cost savings, right? Then saving money, was another appeal, right? Finally, what the pandemic has done that nothing else has been able to do to really create the sense of urgency around this issue of homelessness has been the appeal for the very first time to help people understand that homelessness is a public health issue. By now knowing that the health of the homeless has a direct impact on our own health, our family's health, and our community's health, all of a sudden, everyone is, lifted up and prioritized this issue. And it couldn't happen at a better time because the aftermath and the wreckage of the pandemic is that we are going to see a surge, a tsunami of people that are already falling behind on their rents by months and months and months at a time. And these are the essential workers. These were the people that were one paycheck away from being homeless in the first place, but were managing to make ends meet month in and month out. Well, when they got blindsided with no longer having a job and no longer having an income and the possibility of very high likelihood of not having a job to go back to, even with the vaccine, we are preparing right now for a potential 40% surge across the country of homelessness. And we have to act now. As we're thinking about giving and donating to our favorite charities this year, please consider the idea of prioritizing and meeting the needs of helping our most vulnerable. These are a non-renewable resource too, by the way. So I would say, let's care about the climate, but let's also care about people. Both are equally important. And I hope that, people find it in their hearts and in their wallets, to support these two important priorities equally and in a way that leads people and helps build an infrastructure that we want to live in that helps improve the lives of all stakeholders.
Absolutely. Absolutely. And I mean, there's such a misconception that people don't mind being homeless or that they want to be homeless or it's a choice and that is just simply, not true.
It's lazy on our part, to say that because nobody grows up saying that their lifelong dream for themselves is to be homeless. And gratefully at A Safe Haven, we have lots and lots and lots of examples of people that were homeless for 30 years or more. Many are Vietnam veterans. Many are people that got caught up in addictions and heroin when they were, young, and here they are in their 50s. And most of us, even them, have accepted their lot in life. That's just the way things are. And thankfully, at A Safe Haven, we refuse to accept that everyone we meet doesn't have some God-given potential buried beneath that rubble. And it's our job to discover it, and our job to help foster, what's lying beneath, and to help people realize, hope again, and to get on a path that's going to help them, in many cases, when they've been estranged with their families, reunite with their families, get engaged in the job and get in a position where they can finally support themselves and their families. Some people are going to need subsidies for the rest of their lives, and that's okay. But the good news is we're able to carve out the ones that can go back to work and become positive, productive members of society, and it's never too late. So many of them have reunited with their children. Some of them have even remarried, the spouse that they had been estranged from, and it's just a lot of amazing stories. I actually have a book coming out called
Awesome.
Healing. And the book called Healing is going to feature at least 10 stories of people that fit the description of people that have been homeless and in crisis, many of them for decades, that to date are living the dream. So I hope that book helps people get a little bit of behind the scenes story of how they got there, what happened, and how they got reconnected to A Safe Haven, and how today they've been able to be put on a path that ultimately has allowed them to, take everything they've learned, build on it, and just crush it. So I'm so excited. Many of them are, in law school, directors, and managers, and some even own their own business, and of all backgrounds. So it's pretty exciting. I think you'll love it. It's called Healing, and it'll be coming out on Amazon soon. I also have my own book coming out called An Elegant Solution. But believe it or not, I'm kind of even more excited about the book Healing than I am about my own book, because I think my book is going to be the more practical, story about what we faced as a personal journey and the challenges, which, is going to be our truth. It's not been easy, but, we've got some stories in there. But, I just love the stories that keep me coming back every day. And that is the people who have proven me right every single time.
Yeah, that is so amazing. And I love that you help people find their purpose, uncover their purpose, because as you say, everyone does have a purpose. They want to be engaged, productive members of society. And sometimes it's been working against them their whole life, and so you bringing that back out and helping them kind of rediscover that it is key to hope. It's so important, such an important part of hope. So I'm so excited to share with our listeners a safe haven to have them check out your work and your solutions. It is such a comprehensive way to address homelessness, and we need a comprehensive approach. And I just love how you've built that in Chicago and are now expanding. And I hope people take notice. I think, what's been missing for so long is both the business approach and kind of the lived experience approach. That's definitely true in mental health. It's for sure true in homelessness. And that you're bringing both of that to the solution is so inspiring. So thank you so much. Is there anything else you want to tell our listeners while we have them?
Just make sure that, if you know someone who has a problem that, you feel that has, you've tried everything and you really need to try something different, check out A Safe Haven. I know that our team of professionals, there's not one problem out there that we haven't seen before. We've had over 130,000 people come through our programs. And again, we're not for everybody, but you would be amazed at the people that have come through our programs and today, again, are living the dream. And, we're here for them. We don't give up. We work side by side for them, and all of our services are free. So if you know someone who needs help, please call us at 773-435-8300. Go to our website. And if you can give a little or give a lot, please do it today and don't hesitate. Again, this homeless situation is about to get a whole lot worse. And you mentioned earlier about the mental health. We know here in Chicago, we're experiencing about 100% increase in the number of people that are overdosing. And while we're counting the number of people that are being diagnosed with COVID-19, I wish that we would count the number of people that are being diagnosed with mental health issues at the same time, because then we would understand how widespread this problem is. And we've got to take it out of the shadows and we got to bring it into the light, because if they are not dealt with, then they become part of this homeless population. And this is such a preventable issue if we just knew about it and we're able to connect people to the services that they need before it became something, again, that was catastrophic. And I don't want to say irreversible, because it's never too late to fix it, but we prefer to prevent it if we can.
Yeah, absolutely. I know the recent numbers, 40% of people dealing with anxiety, depression, increase in substance abuse, 11% considering suicide regularly. I mean, the numbers are getting high. And again, that is going to directly impact if you're depressed and you can't get out of bed and you can't get to your job and you don't have anyone to talk to. I mean, you think about the kind of cascade effect of that. So thank you so much for what you're doing and how innovative you are in solving this really big global challenge. I hope people donate. I hope they take notice, and I hope to see your work expand across the states. So thank you.
God willing. Thank you.
Yes, thank you.
Bye, Kathryn. Bye, everyone.
All right, thank you.
So thank you all for listening in to the Hope Matrix podcast. We want to shine a light that hope is teachable, hope is measurable and teachable, and provide you with actionable insights for how you can start activating hope in your life today, and provide a framework so you can start talking about hope with other people and practice these skills together, because we are better with hope. Please feel free to check out theshinehopecompany.com, where we list all of our resources around how to hope. We have a lot of free programs for how to hope, including the 5-day challenge, our hope infographic with a lot of skills that showcase how to hope, and articles of how to incorporate hope into your life. We have the Hope Beat Weekly, which is a weekly newsletter that shares strategies for hope. We have a My Hope Story template, so you can write your own hope story today. Also, My Hope Hero, so we can share what our heroes are doing to activate hope in their lives. And this is especially good with youth, so they can start looking up to people that have overcome similar challenges to them and seeing how these heroes use the Shine Hope framework. We have a Hopeful Minds for Teens program, a Hopeful Minds overview, educator guides. We have a new evidence-based college course so you can activate hope on the college campus. There are programs in the workplace, overview courses, 90-minute courses for learning the what, why, and how to hope. What I want you to know about hope is it's a skill. You've got to practice these skills to become hopeful. It's easy to fall into despair and helplessness when we deal with challenges in life, and it takes intentional work and practice to get to hope. And yet it is always possible. So no matter what life brings, keep shining hope. Thanks so much for listening in. Have an awesome day. And of course, I've got to add that this program is designed to assist you in learning about hope. It should not be used for medical advice, counseling, or other health-related services. IFRA, the Shine Hope Company, and myself, Kathryn Getzke, do not endorse or provide any medical advice, diagnosis, or treatment. I am not a medical doctor. The information provided here should not be used for the diagnosis or treatment of any medical condition, and cannot be substituted for the advice of physicians, licensed professionals, or therapists who are familiar with your specific situation. Consult a licensed medical profession or call 911 if you are in need of immediate assistance. And be sure to know the crisis hotline, 988, if you are in need of support. Thanks a bunch for listening. Take good care of yourself and keep shining hope.